For all the latest updates, subscribe to News9.
The Union Health Ministry has updated its advisory on the testing strategy of COVID-19. With the new advisory, the Health Ministry has introduced on-demand testing without a prescription. The Health Ministry has given the state authorities the right to modify the modules released by the ministry accordingly. A totally new section has been added in the advisory on testing on demand, which for all practical purposes does away with prescription by a registered medical practitioner, although state governments have the freedom to decide on simplified modalities. However, tracking and contact tracing mechanisms should be ensured by the testing laboratories by notifying the public health authorities. The Union Ministry of Health also highlighted the frequency of COVID-19 testing in the country. The ministry stated that a single RT-PCR TrueNat, CB-Nat or RAT positive test is to be considered confirmatory without any repeat testing. According to the ministry, no retesting is recommended prior to discharge from a COVID-19 facility after clinical recovery. Before the Ministry of Health released the guidelines, the Indian Council of Medical Research had updated their COVID-19 testing strategy. ICMR suggested that 100% of people living in containment zones should be tested by rapid antigen tests. Ideally, it is suggested that 100% of people living in the containment zones should be tested by RAT, particularly in cities where there has been a widespread transmission of the infection. No emergency procedure should be delayed for lack of tests, and pregnant women should not be referred for lack of testing facility. The existing recommendations that are related to testing for COVID-19 have also been extended, elaborated and divided into 4 parts. They include routine surveillance in containment zones and screening at points of entry, routine surveillance in non-containment areas, hospital settings, and testing on demand. The guidelines also highlight that no emergency procedure should be delayed for the purpose of a test. As per the guidelines, if symptoms develop following a negative RAT test, a repeat RAT or RT-PCR should be done. The ministry said that the new advisory has simplified the testing process. The new advisory has further simplified the testing process and has given more freedom and flexibilities to the state authorities to facilitate enhanced ease of testing for the people. Meanwhile, India's COVID-19 tally breached the 41 lakh mark with a record 90,633 new cases being reported in a single day.